Welcome back into WDHN Daytime. Now, I'm here with neuroendovascular surgeon Dr. Kevin Chow. Thank you for joining us today and being here. And now we're going to be talking about, some, health concerns about, taking care of stroke care and brain aneurysms and things in that field. Now, my first question for you is, what should people know about stroke care and why is fast treatment so important for people?
Yeah, so I'd say, stroke is very important. It's an emergency, obviously, so you want to get there as quickly as possible. If you think of the brain as a city powered by electricity, well, stroke's the power outage. And so brain cells can get affected pretty quickly. And, we have the ability to turn the lights back on. We just have to act quickly. So there's a procedure called a mechanical thrombectomy where we use catheters inside the blood vessels to navigate to where the clot is and then physically remove that clot from the blood vessel supplying the brain. And so that's really good, and how quickly we act and are able to treat this will determine, is someone paralyzed or can they walk out of the hospital? So very important to recognize the signs and symptoms of stroke and then call 911 immediately.
Now, if someone has a loved one that, the word has a high risk of a stroke or has a brain aneurysm or anything like that, what can they do to prevent this?
Yeah, that's a great question. So the most important thing to know is that many of the complications from stroke or an aneurysm can be preventable. High blood pressure is a major culprit, so we want to have that treated as quickly as possible. There's others, so if you have a family history of stroke, if you have high cholesterol or diabetes, getting that screened and then treated appropriately is really important. Aneurysms are a little more tricky, so they typically come up when someone's already had a head bleed, but if you happen to get a scan for headaches, we can treat that before it becomes an emergency.
And I know we've just mentioned this before we went on, is that you're new to the Dothan area.
Yeah.
You moved here pretty recently, and you've trained at some of the busiest academic medical centers in the country. Now, how has that experience really influenced the care that you've provided so far in the Dothan area?
Yeah, thank you for asking that. So, first of all, I think training at some of these busy academic centers allows for pretty complex, challenging cases that you wouldn't otherwise see. My goal is always, no matter where I am, to provide the highest level of care and cutting-edge technology. That certainly helps. We have a lot of new tools, so if you come to Southeast Health, this is something that we can offer. One thing in particular is, we'll go over the imaging and really make sure you understand everything that's going on, and then kind of talk through each of these options so you know that everything is available to you and how to go for it.
And now, what are some of the advanced treatments you offered that weren't available in Dothan before you came?
Yeah, that's a great question. Treating aneurysms in a different way. There's newer devices, intrasaccular devices, that can actually close off the aneurysm and reduce the way in which it affects people. One other big way is we typically have to go through an artery, so it's usually the femoral artery in the groin area, and it's becoming more and more popular in the country to go through the radial artery. So we can go through the wrist, navigate around the arch of the heart into the neck, and treat things as we need. And it's safer, it's more comfortable, and there's a faster recovery. So that's something that I'm hoping to bring more.
And if anybody needs to come and see you for any of these signs of any stroke signs or anything like that, what's the first step that someone has to take?
Yeah, so a stroke is a serious condition. Brain aneurysms can be scary. Really any neurovascular condition. I think as long as you can, when you get the image, you can talk to your primary care to get a referral. One of the things that you can expect is we'll talk through everything so that you understand what's going on. We'll review the images so that you can see it for yourself. And then we'll outline each of these different options so that you know all of the options that are available to you.
Now, you've talked about many important steps and honestly signs that people should, be aware of when it comes to stroke care and brain aneurysms and really just taking care of yourself. And it really just seems like you've been a great asset to Southeast Health so far.
Thank you.
Yeah, of course. And we do have some more news and weather coming up on daytime for you. Your time is 11:32. It's 71 degrees outside still. And here's another look at the Gulf. Now, Dr. Chow just mentioned he'll be there in a few hours. So I'm pretty jealous about that. We'll be right back.